Hi, everyone. My name is Lynne Kerr. I am a physician scientist, now retired, the only retired person in the Capella Fellowship cohort this year. I have learned so much during the fellowship, and I'm excited to continue to work at advocacy in the future. I started my journey as part of the first generation in my family to go to college. My grandparents were immigrants from Poland and Ireland, and the first in my family to go to medical school. My family was surprised to hear of my plans. My husband and I left the East Coast for jobs in Utah, and I eventually went to medical school. I was one of only 10 women in a class of 105. The photo on the left is me in the spring of my first year. You weren't supposed to have children in medical school then. There was no maternity leave. Believe me, I have lots of stories to tell of those years. The photo on the right is me graduating, standing with my husband and oldest son. We went on to have 4 children, and I became a pediatric neurologist specializing in neuromuscular disease. This is my family years ago, me, my husband, and our 3 boys, as well as our daughter Madeline, who had Cornelia de Lange syndrome and cerebral palsy. We were lucky to have insurance and resources to give her everything she needed. She passed away at age 18. I cared deeply about care for children and adults with disabilities. I had some difficulty figuring out what I wanted to do for my capstone project. Things in this country were changing so rapidly, and I wasn't sure what I could do to make a difference. As part of the Access to Affordable Care Impact Area on the Egregious team, we published examples of greed in the medical system in the DFA newsletter. One example is shown here: greed by hospitals, doctors, insurance companies, big pharma, pharmacy benefit managers, everyone. But it seemed that we were just preaching to the choir. Then I started working with Angie Backey, our executive director, and Elise Cassell, the program director for the Washington Underserved Patient Pathways Program. This project dovetails well with my current position on the admission committee of the medical school in Utah. We're working on an advocacy curriculum so that medical students can learn necessary skills and receive training to develop into good advocates for their patients, a necessary, not optional skill right now. There were other ways that I participated in advocacy efforts. I went to Washington, D.C. with the DFA FDA task force and met with staff of various senators. Here we're shown with Ted Cruz to advocate for our patients, especially in regard to the fast-track drug approval program, which harms my patients with Duchenne muscular dystrophy. We also advocated against Medicaid cuts, so maybe we weren't that successful, but it's a process. I worked on several other projects as well, publishing an op-ed with Lorraine Cesny, a local internist who's also in DFA, addressing Medicaid cuts. I moderated the Vaccines Under Pressure DFA Grand Rounds with Paul Offit and Judith O'Donnell. Despite being a pediatrician, I learned a lot about vaccines. I also hosted a Docs on Call session, one of many, which was lots of fun, but we still lost the fight to save Medicaid in the end. But we'll keep trying. I started looking locally to see what I could do to make a difference, particularly as national politics are messy currently. I met with Scott Poppin, who was the past DFA board chair and credited with getting the Utah Medicaid expansion passed. I joined the Utah Health Policy Project and attend their conferences. I intend to stay involved with DFA and perhaps can work between the Utah Health Policy Project and DFA in the future. Utah is a somewhat unusual state for a red state. Our Governor Cox was the last red state governor to endorse Trump only 3 months before the election. This photo of a Utah citizen is taken on a path behind my house. Utah tends to have a pretty healthy population and to feel like we should take care of our population, but it's not perfect. There are still many without insurance, for instance, and the recent bill that passed, I don't even want to say its name, will set us back, but we'll keep working. I like the quotation, "If opportunity doesn't knock, build a door." That's what we have to do. I intend to keep working to improve healthcare for my patients and their families, and for future patients like my granddaughter shown on the right. In conclusion, thank you, DFA, for the opportunity to be a Capella Fellow. I learned a lot, met many wonderful people, and had a lot of fun. I plan to stay involved in the future. And a special thanks to Angie Backey.